Ahead for us this half hour, kids and COVID. Cases and hospitalizations headed up here and around the country. We're going to get some perspective on it from a top doctor at our children's hospital. Plus, the financial impact to the Bills and Western New York on the team's playoff run. We'll break down some of the numbers there. And if you're planning to ask for a raise in the new year, you are not alone. We'll talk with a national reporter who got some advice on how to ask for more money. Thank you for being with us, everybody. Over the last few days, you may have seen headlines about all-time highs in the number of kids hospitalized with COVID. It is a concern for parents after all of the news throughout the pandemic that the disease affects children less. The CDC says on average right now, there are 830 kids a day getting admitted to the hospital with COVID. This is as of last week from the CDC. Now, that's just a fifth of the rate for the general population. This is, of course, still much more dangerous for older folks, but it is a dramatic increase in pediatric hospitalizations. Now, experts do warn that just like with adults, there are cases in which kids are getting admitted for something else, but then testing positive once they get to the hospital. Joining us live to talk about what's happening with kids here in Western New York is Dr. Turkovich, Chief Medical Officer at Oishei Children's Hospital. Dr. Turkovich, thanks for coming back on.
My pleasure.
So let's start here with something that Dr. Anthony Fauci, the president's chief COVID medical advisor, said in terms of what we're seeing with children right now. Listen.
Now we know that children 5 and older can get vaccinated. Please, parents, vaccinate your children. We're seeing children in hospitals throughout the country, almost all of whom are not vaccinated. The vaccines are effective and they're safe.
So, Dr. Turkovich, what's going on at your hospital in terms of children with COVID? Does it match up with, the surge across the country? And are your patients mostly unvaccinated, as Dr. Fauci suggested?
Yeah, unfortunately, we're following the same trend that we're seeing across the country in terms of admissions. To put this in perspective, around Christmas time, we started to see an exponential increase in the number of kids coming to the ED testing positive for COVID and the number of kids admitted. Prior to Christmas, we had about 7 cases a day in the emergency room. Since then, we've had about 40 positive cases a day. Admissions were averaging about 1 per day before Christmas, and now they're about 4 per day. Since January 1st, we've had 41 kids admitted with symptomatic COVID, an additional 8 that were admitted for other reasons and happened to be positive for COVID. So to put that in perspective, we had 43 total children admitted with symptomatic COVID in December. So we're on the track for over 100 kids admitted this month with symptomatic COVID. Some of the kids are admitted with COVID and other viral illnesses like RSV, and it's unknown whether or not the RSV is causing the illness or the COVID or both. It's likely both, given the fact that having 2 viral illnesses is going to make you much sicker. When we look at the children that are admitted, the vast majority of them are less than 5 years old, so they're not eligible. But of the ones that are admitted that are eligible to be vaccinated, the vast majority of them, again, are not fully vaccinated. So it is very important for you to get vaccinated if you're over 5 years old. And if you're an adult living with younger children, the best way to protect them is to surround that young child with people that are fully vaccinated and boosted if you're eligible.
And Dr. Turkovich, we'll talk about vaccinations more in just a moment, but you mentioned RSV. It is the time of year that, sometimes kids are affected by, seasonal illnesses. But it's also the case that if you have these additional COVID patients, that it can put a strain on the healthcare system. We're seeing that in our, adult hospitals, right? Even if it's not all COVID patients, we're seeing that strain on the resources. Is that the case there at Children's as well with RSV and all of these other things that are bringing kids in?
Well, we're actually very fortunate because the RSV surge happened earlier this year than it typically does. So it typically hits in November and December and then peaks later on. And this year it really hit in October and started to trail off in November and December. So the number of admissions for RSV are very, very low compared to historic norms. Also, we start to see flu around this time. We have seen a little bit more flu this year than we have in last year. However, we have not seen dramatic increases. But I will say that typically flu will start to peak in February or March. So it's also a very good reason to get your flu vaccine.
Governor Kathy Hochul announced her Vax for Kids campaign today. It's kind of this marketing push to try to convince parents to get their kids vaccinated. Those age 5 to 11 have now been eligible for the Pfizer vaccines for 2 months, that younger age group, but less than a third have gotten at least 1 dose. What do you think is keeping that number so low?
I think there's still a lot of misinformation out there. There's a lot of fear and some hesitation. I know about a third of the adults out there had said that they wanted to wait to see to get their child vaccinated. I can say that the CDC and the FDA have been looking very closely for any signals for any severe side effects, like that myocarditis, like we saw in some of the older teenagers. And thus far, over the last 2 months, we have not seen any signals in the 5 to 11-year-olds. So it's really important. It's safe. It's effective. I always tell parents I wouldn't do something that I wouldn't do for myself. Both of my children are between 5 and 11, and they're both fully vaccinated and did well.
Yeah, and I believe, correct me if I'm wrong, but you got them vaccinated like the day they were eligible, right? I mean, you wasted.
I sure did.
You wasted no time. That's very telling. Finally, with so many cases among kids right now, and also, teachers and staff catching COVID, having to isolate at home, even if they're not really sick, we have more and more of our schools going full remote, at least temporarily. We've all been following nationally what's happening in Chicago, which went fully remote as they kind of had this standoff with the mayor. Also, daycares are now struggling through all of this. I wonder if you can address some of that and the question of whether or not this is an overreaction, because we've talked so much and heard so much about the importance of having kids in the classroom and the damage that virtual learning did at the beginning of the pandemic.
Yeah, I think you're correct. And I think most people will recognize that being in school is not only very good for kids, for their physical, cognitive, mental health, but also it's a safe place to be. As long as you have those layered risk reduction things like masking and social distancing and getting kids vaccinated. I think the unfortunate reality is that some schools are closing because they have staffing problems, because they don't have enough substitute teachers and teachers to actually care for them or to teach them. So at the end of the day, it's really important, if you're a teacher, please get vaccinated. We obviously want you to stay safe and be able to stay in school and teach your students. But I think, unfortunately, the reality is many schools are closing, not because we want to prevent the spread of COVID or because it's unsafe, but because too many people are getting sick.
And finally, Dr. Turkovich, we're almost out of time, but one of the things that we hear from parents all the time, and you kind of touched on this, is they wonder if COVID is serious enough to children to warrant them going out and getting the vaccine. How do you answer that question when people undoubtedly pose it to you?
Well, there's acute effects and there's long-term effects. The acute effects, we are seeing kids get admitted with comorbidities, and those without comorbidities who are otherwise healthy. We have seen an uptick in the number of kids admitted with multisystem inflammatory syndrome, and that can be very severe, requiring ICU care. And recently now studies have shown that children that were infected with COVID have an increased risk of developing type 1 or type 2 diabetes. And so there may be other long-term effects that we don't know from the acute infection. So the best way to protect yourself is to get vaccinated and prevent you and your children from getting the virus in the first place.
Dr. Stephen Turkovich is Chief Medical Officer at Oishei Children's Hospital. Thanks so much for coming back on. Good to see you.
Thank you.
All right, we have been under a mask mandate in the state of New York for a while now, and some of the guidance has changed due to the Omicron variant and how contagious it is. It's led to questions for our Verify team. Cloth masks just are not as effective as they were before, and that's leading a lot of people to turn to N95 or KN95 masks. Unlike the cloth coverings, though, you can't just toss them in the washer and reuse them. So tonight we have a look at a claim that you might be able to get more use out of them. Lindsay Mills talked with the experts.
The type of mask you use has probably evolved over the pandemic. If you've recently upgraded to a surgical mask or KN95 or an N95 mask, you're probably missing the convenience of being able to wash it and reuse a cloth mask. But there's a lot of chatter online about a paper bag trick, like this post on Instagram that shows how to sanitize your mask in a paper bag to be worn again. Is there any truth to this trick? Our sources are Dr. Joe Gastaldo from Ohio Health and Dr. Jessica Shepard, Chief Medical Officer of Verywell Health, based in New York.
The concern about wearing a mask in public, obviously, is if you get particles on it, perhaps even the virus. But if you store it in a dry bag, you are essentially sanitizing it again over a period of time. The KN95 masks do work well, assuming that it is a FDA authorized mask.
So it's not the bag that's doing the magic trick. It's actually the process of keeping the mask, one, away from decontaminating someone else or a surface, and also keeping a dry environment in order for the virus to not spread or stay on the mask.
Our experts recommend storing your mask in a paper bag for 24 to 48 hours in a dry place. So we can verify it's true. You can sanitize your mask in a paper bag so it can be worn again. This is not recommended for healthcare workers, but for you and me, it can extend the life of something we use every day. And thinking about upgrading your mask from a cloth one, our experts say now is the time to do that.
And you really want to think about having the highest quality of mask as possible. When it comes to how a mask performs, the ones that perform the best in public filter up to 95% of particles at 0.3 microns. And in that regard, you have to use an N95 mask. But I think what's more available for the public are KN95 masks.
The thing really is making sure that you can have access to a mask, period. But if you do have the ability to choose between a cloth and an N95, the better option is going to be the N95.